Alf here, once again at Vente Pain Relief Clinic, and today we have a clinical tip and trick. Today we're going to talk about the scalenes and how to release the scalenes via the subclavius. Many of us have tried working on the scalenes and we found it very difficult at times to get it to release, and this is one way that I found to get that stubborn muscle to relax via the subclavius. But first, I just want to talk a little bit about why I'm doing these videos. And the reason why I'm doing these videos is that I've had 18 plus years of experience, and I want to share my knowledge both from a clinical standpoint and also from a business standpoint. The stumbling blocks that I've had, how I overcame them, and I'm hoping to relay these the stuff that I've learned to you, and hopefully it'll help you, both again from a clinical standpoint and also from a business standpoint. The one thing that I also had an issue with when I first started was integrating the healing side with the business side. So hopefully what I teach on these videos can help you integrate the two, because it's possible to be a healer and be prosperous at the same time, because sometimes that can be a bit of a struggle. Maybe not all of us feel that way, but that's how I felt when I first started up, and you might be feeling that also. So if you feel that I can help you, tune in every Tuesday at 12 p.m. on Facebook or YouTube. I premiere videos in regards to clinical stuff and also business stuff. So that's just something for you guys to potentially look forward to. So today we're going to talk about the scalenes and using the subclavius. Let's start off with the potential symptoms that may be alleviated. So we're looking at radiating symptoms down the arm, because as you can see here, this tube here, it's not exactly accurate. I should have cut off the tube right about there. That indicates the neurovascular bundle. If the scalenes are very tight, it can press on that neurovascular bundle, causing those symptoms down the arm. Tightness and pain of one side of the neck, either when stationary or during movements. The person will complain. If it's a right-sided thing, they'll complain about the right-sided neck tightness and potentially pain. When they're side bending to the opposite side, they might find the symptoms on that same side become more painful. The symptoms might be more exaggerated. Referral symptoms to the chest, medial aspect of the scapula, down the arm towards the radial side of the hand, thumb, first and half of the ring finger. That's basically the trigger point for the scalenes. So if they come in and they're telling you that this is like what I'm feeling into my chest, into my shoulder blade, down my arm, it's potentially the scalenes you've got to look at. So in terms of clinical presentation, they're going to have potential local pain and tightness of the side patient that on the side the patient is complaining about. The upper pectoral fascia, when you palpate into the upper pectoral fascia and subclavius, you'll notice there's a lot of tightness. Mobility of clavicle may be limited, so if it's very, very locked, if that area is very locked, you'll find that there's not much give. If you're comparing both right sides and left sides, there should be about a millimeter, maybe a slight difference in terms of motion. If it's very, very stuck around this region here, if the area is very tight, you'll find that there's going to be a lack of mobility around the clavicle. There's also local pain, we mentioned, and upon palpation of the scalenes, the person might indicate to you that they're feeling pain down the arm, or the symptoms are going down the arm. Rotation and contralateral side bending may be uncomfortable and limited. This is a very important one. First rib may be immobile or seem more in a superior position relative to the unaffected side upon palpation and assessment of the first rib. So if I am feeling around the first rib here, say we have Skelly lying supine, I'm palpating into the area of the first rib, I will notice that if it's very tight, that the rib that's problematic will be slightly more superior. So it's maybe about a millimeter or so. You'll know when you palpate both sides and you compare the two sides. You'll also find when you're pushing inferiorly that first rib does not move. That's an indication that the scalenes is very, very, very tight, and the first rib is locked in place. Also, to go along with the first rib, when you actually try to manipulate, I don't like using the word manipulate, but when you try to laterally challenge the cervical spine, the different segments, when you go from the affected side to the unaffected side, it'll seem very stuck. It won't move well. So you're going to find that there should be about a millimeter of give, both left and right. You'll notice from affected side to unaffected side, there's not as much motion relative to the unaffected side. So there will be more give going the direction towards the affected side. That's an important clinical note because the first rib and the vertebrae aren't moving well. That indicates that scalenes is really, really, really tight. It might be in full-blown spasm. So in terms of treatment sequence, this is how we go about doing this. Right? So this is not a treatments techniques video. This is more sort of to give you an idea, a mindset in terms of why we're going in working with the subclavius. As I mentioned before, the skin can get very tight, and we got to find other ways to get that muscle to release and to get the symptoms to die down. So you're going to assess before, during, and after the range of motion of the cervical spine. You're going to ask the patient about their symptoms, see if they're getting any referral down to the chest, into the arms, into the shoulder blade. You're going to assess and treat the scalenes. So if scalenes lying supine, I'm going to go in there, do my techniques to see if I can relax the scalenes with my soft tissue techniques, with stripping, maybe an ischemic compression here and there. You're going to assess the first rib. You're going to see, again, as I said, you should notice a difference from left and right, affected to unaffected side. If the first rib isn't moving well inferiorly, or if it's seen as more superior, that tells you that basically the scalenes are pulling the first rib up because it's so tight. You can assess the lateral motion of the cervical spine, right? So after the first rib, you're going to check to see how well the cervical spine moves, the different segments. Check to see how stuck it is going to the opposite direction. You're going to then assess and treat pectoral fascia and subclavius, particularly if you're seeing that there's not much give in terms of the scalenes. This is the final stage. Obviously, if it's giving, then you don't really need to go to this stage, but you're going to assess the pectoral fascia. You're going to check to see the motion of that fascia around the upper pecs in particular. You're going to palpate around subclavius, and that person might tell you, I'm getting symptoms into my shoulder, into my collarbone, and down my arm into my bicep. So if it's very, very tight, you're going to treat this area, try to soften it up, see if the subclavius lets up. And then when that's done, you're going to go back to stage one, where you assess range of motion, ask the patient basically what their symptoms are, if anything's died down. You're going to assess and treat the tightness of scalenes again. Hopefully it should have loosened up. Assess first rib and assess lateral motion of the cervical spine. Go back to the pectoral fascia and work on the subclavius. So that you're going to repeat this, and you should notice more changes as the pectoral fascia and the subclavius relax. You should notice more give with the first rib and the cervical spine segments. So if you're doing this correctly, you should notice an improved range of motion with the person on the table, improved inferior motion of the first rib, improved motion of the vertebrae laterally, decreased local symptoms, and decreased referral symptoms. So that should occur when they stand up. They should notice more of a change in the way that they feel. So if you've got questions about this, feel free to message me, email me at admin@ventepainrelief.ca. Hopefully I can answer your questions. Next week, we will be learning about releasing neck spasms via working with the junction of L5-S1 and the thoracic spine. So that should be a very interesting one. If you've never done a treatment like what I'm describing right now, working with those segments to work on the neck, it should be an interesting one for you. Also, watch for upcoming announcements of courses for therapists. I'm hoping this video has helped. Hopefully you can apply it to your clinic and improve your soft tissue techniques. This is Alfie again. Have yourself a great day. Take care.